Recording right now. Okay, so for a lumbar supine, so for lumbar, you're going to have two options. You're going to have supine or prone. Okay, supine is going to be more flexion-based conditions, so stenosis, spondylolisthesis, facet syndrome, and anytime a patient is older and they can't lay on their stomach for 20 minutes, or if they're really heavy and they don't want to lie in their stomach for 20 minutes, then supine would be the best position for that, okay? So that's what we're going to go over today is lumbar supine. And one thing I want you to check on your computer, is your computer on right now?
Yes.
Okay.
You are on the computer.
No, I mean, sorry, the computer on the table right next to where the white cord is.
No, that's not. Let me on the but you on the but you that
Yeah, there should be a key down there that you'll turn to turn the table on.
We have changed the law already. Do you remember? We had to change the law. Hello? Yes. The computer is on now. It is coming. अरे तुम चल डांसों को सेट कर दो हैं तो ये बच्चे लोग
Okay, does the computer come on?
Yes.
Okay, then hit the button that says I agree.
We've done that.
Okay.
We have done that.
Now go into the menu that says sorry, go one quick second. Okay, go into the menu that says library.
आप ये सारे के सारे बीच में इतनी जगह छोड़ दो उनको देखिए ठीक है
And then just make sure it's on kilograms in there and not pounds.
How we can
Oh, sorry, go to maintenance, in the upper right hand corner in the red maintenance.
Yes.
And then just make sure it's on kilograms and not pounds or newtons.
It's on kilograms.
Okay, then you're good. Then just go ahead and go back. It'll stay on kilograms as long as nobody changes it. I would just every once in a while, just check and make sure it's on kilograms.
Mr. Brian, is on kilogram. Should we go back to main menu?
Yeah, just go back to main menu.
Okay.
All right. So now go into the menu that says elevation and targeting.
Yes.
Now, in this menu, if you hold down the lift table.
Yeah, lift table.
Yep, hold it down. Okay, hold down the lower. There you go.
It's going up.
Yep. And then hold down the lower table.
Yeah, it's going down.
Okay, so this is for patients getting on and off the table, to get it at a comfortable height so that they can get on and off the table very safely.
Okay.
Okay, now go ahead and hold down the lumbar flexion up. So if you want more flexion while they're supine, then you can hold down the lumbar flexion up, okay? Go ahead and hold down the lumbar flexion down. So you can actually, on this table, you can actually go past neutral. So keep holding it down so it's aiming down.
Which one? Aiming down. Number down. No,
lumbar flexion down. Lumbar
yeah,
flexion down.
Yeah, it's down.
But keep going. Yeah, I want to show you can put it into extension as well.
Okay.
Yeah, now it's going down.
Yeah. So if a patient was supine and you wanted extension, then you could put it in extension. Okay. If the patient was prone, then this would be prone flexion. Okay. Now, underneath the number where it says L5S1, you'll see where it says flat.
Yeah.
So go ahead and hit flat and then begin targeting setup.
Touch targeting setup.
Yep, begin targeting setup.
Okay.
And that'll always take your table back to flat. Okay. So regardless of whatever angle.
Should we go back to the flat position?
Yeah, always the table's always going to be flat when the patient is getting on or off the table.
Okay.
Okay. So, and to make it go flat, just hit flat and then begin targeting setup makes it go. Okay. Now, if you want to choose a predetermined disc angle, go ahead and hit L5S1 and then hit begin targeting setup.
up करो उसके बाद begin targeting setup के बाद up करो वो दोबारा नहीं हुआ
Just press one time.
Go ahead and hit L2, L3.
L2, L3.
And then begin targeting setup. There you go. Okay.
Yeah.
Now hit L4, L5. And then begin targeting setup. There you go.
Okay.
Okay.
Fine.
And then hit flat. And then begin targeting setup. There you go. So do you see how you can choose the predetermined level if you want? Now, sometimes the predetermined level is not comfortable. So in those cases, then you can just lumbar flex up or down depending on patient comfort as well. Okay. So you can choose the angle either way. You can use the predetermined angle, or you can just lumbar flex up or down manually as well. Does that make sense?
Yeah. So basically, there are 5 predetermined angles.
For all the lumbars, correct.
Yes. And if we need to do, if we need to change it manually, then we have lumbar flexion up and lumbar flexion down.
Correct.
Right.
Okay. Now, next is if somebody goes to the bottom of the table. So if you go. Okay, so if you go to the bottom of your table here, you're going to have 2 handles.
Yes.
Okay, if you squeeze just the left mechanism with your left hand, you're going to see that your table is going to laterally flex left and right.
Sir?
Okay, and if you squeeze just the right one, you're going to see that your table rotates left and right. Okay, so you have rotation and you have lateral flexion. Okay.
Right.
So sometimes if a patient is, if they have a herniated or a bulging disc and they're sitting like this, and this is the only position that brings them relief, then you're going to want to treat them in this position. So you would treat them in left lateral flexion and left rotation. Okay. So then you would put your table into left lateral flexion and then left rotation.
Yes. Fine. Fine.
Okay.
That's okay. Mr. Brian, just hold on. Hello.
Yes.
Just hold on. We'll do it in front of you. Is it like that?
Correct.
Is it okay?
Yep. So the point is that you want to treat patients in the position that brings them relief or centralization of their symptoms. So if they have shooting pain down the leg, numbness, or tingling, you want to put them in the position that brings that up out of the foot and the leg into the spine. Okay? So anything that makes the symptoms go farther down the leg is making it worse. Anything that kind of brings the symptoms up towards the spine is centralization, and that's making it better.
Right.
Okay?
Okay. Okay.
Okay.
Any
Yeah, okay.
questions so far?
Yeah, one question. We have to rotate or lateral flexion this table while patient is on the table, or first we will adjust this table position and then we will take patient on table.
Great question. Put them on the table first, and then put their harnesses on, and then the last thing you would do is put them in the lateral flexion and rotation.
Okay, thank you.
Mm-hmm. And I'll show you that now as well. So what we're looking for on the harnessing,
Yeah.
right? So on your harnessing, you have this red line here.
Yes, we have got
Okay.
that.
That red line is always going to go in line with the bottom of this cushion right here. So you have this gap in the table.
It will be in between here.
Yeah, you want the red line to be at the top of the gap, where the bottom of the thoracic cushion here.
Yeah.
Okay? Okay.
Right.
And then this top, the thoracic harness, you see there's a red tab. So you have two red tabs here. You have this red tab and this red tab.
Yeah.
Okay? Now, those two should be centered on each other. And
Okay.
the distance between these two is equal to the distance from the top of the iliac crest to the
Right.
lowest rib. Okay? So if a patient is very short, then this thoracic harness is going to slide all the way down. So you would loosen it up here. And these two red tabs would be touching each other. Okay? That's for your shortest patient.
For shortest patient.
Yep. Exactly. Perfect. Okay?
Right.
Now, as the patient gets taller, then the pelvic harness stays no matter what. This upper harness slides up. So about 2 to 3 inches would be about an average size male. So about 5'11" to 6 foot tall would be about 2 to 3 inches here.
Right.
Okay. 6 feet tall to 6 feet 5 would be about 5 to 6 inches here.
Okay.
Okay. So again, you're going to be anywhere from completely touching for your shortest patient,
Right.
up to about 5 to 6 inches for your very tallest patient.
Right.
Okay.
Okay.
So let's treat. Can we treat the young man that's there? Because he'll be an easy one to set up.
Young man.
Okay. So how tall is he?
Sorry,
How tall is he?
5'7".
Okay. So 5'7". Again, we're going to put this red line right at the bottom of the thoracic cushion. Okay. And then 5'7", we're going to have probably about a 2-inch gap here.
Okay.
Okay. So once you have your gap, now go ahead and pull this tight up here so that this one is not going to move. Now it's exactly where we want it.
Okay.
Okay. Now what we want to do is, first of all, have him take off a belt if he's wearing a belt. And then have him take everything out of his pockets. So keys, wallets, cell phones, everything out of the front and back pockets.
Yeah, probably ठीक था बंदों को थोड़ा से आदमी को वॉलेट की बीमारी आई मैं सब दिखा दूँ
Okay.
Yeah.
So now, okay, so we've got about a 2-inch gap here. Okay.
Exactly, it's almost.
Before he gets on the table, what you want to do, grab this harness and grab one seatbelt in each hand. Okay, so one seatbelt here, one seatbelt here. Okay, so it's going to be nice and spread out.
It is already there.
Yeah, it's there.
I know, but grab it like this. Grab one in each hand. Wait, grab your whole harness like this. There you go. And then what you're going to do is you're going to set it down one time, okay? So again, you're going to set it down with your red line right at the bottom of that cushion, and then Velcro this side so that it stays, okay? The other side, closest to the doctor on the other side.
Sorry.
Perfect, okay? Now what you want to do is you want to go to hold it with your left hand.
Okay.
Okay, perfect. And then with your right hand, you want to point to where you want the patient to sit, which is going to be right at this corner here. Okay, so right where the table starts to go in is where you want them to sit. If they sit too low on the table, then when they go to lay back, you have to scoot them way up. Okay, so about right here is about where you want them to sit.
Yeah.
Exactly. Okay, now go ahead and have him lay back. Go ahead and lay on your back. Go ahead, yep, lay back. Okay, perfect. Now, the first thing we want to do is to line up his iliac crest with the top of this pelvic harness, or the ASIS with this red line. So the harness stays. He's going to slide up or down until we get the iliac crest with the top of this pelvic harness.
Red line should be.
Looks like he needs to go up just a little bit, maybe. Just a tiny bit.
So, Mr. Khan, this red line is now in line with the.
With the ASIS.
Yes.
Yes.
Okay, that looks good. Now, the easiest way to do that is to grab this one with your right hand.
Okay.
And then tuck it under and reach across with your left, and then just kind of get your hand out of the way and then pull this straight across. Okay, and it should be pretty tight. I say it should be snug, you know, tight but not too tight.
It should be normal.
What's that?
I mean, it should be normal. It should not be too tight or too loose.
Yeah, it should be more on the tight side than the loose side. I think just a tiny bit tighter. He needs to slide up just a tiny bit too. That's okay, that's close enough. Okay, so now grab your seat belt.
Yeah.
And bring that around and come straight across. Before we do that, go ahead and have him sit up for 1 second and take this seatbelt off and run it through the other way. Pull it through the back here. Run it through so that your extra fabric, so that this is on the side of the computer. So pull it all the way through. And then turn it around and run it through the other way.
Oh, right.
Okay, go ahead and have him lay back down. Now when you bring it across, all the extra fabric should be on the same side as you.
Okay.
Now, the easiest way to get that tight is to, with your left hand, grab the extra fabric. With your right hand, grab the fabric before it goes in through this buckle, okay? So you're gonna feed it with your right as you pull with your left. So you're feeding it with your right as you're pulling with your left. No. Grab with your right hand, grab here. Grab here. Before it goes into the buckle. So you're feeding it with your right as you're pulling with your left.
Yeah.
Okay. It still needs to be way tighter. You got to get that. You got to get that pretty tight. No. So grab with your right hand, doctor. With your right hand, grab here before it goes into this buckle here, and then with your left hand, grab the loose end.
Okay.
No. Close it. Go ahead and keep it closed.
Yeah.
Go ahead and click it. Click it tight. Okay. There. Now feed with your right so you're feeding with your right as you're pulling with your left before it goes into this buckle.
No, sir, वो ये कह रहे हैं कि आपने ये वाला इसको बोला ना कि यूज होना चाहिए कि आप इसी उसको ऊपर नीचे कर सकते हैं ये होना चाहिए उनका पॉइंट ये
Mr. Bright, I mean now apparently it seems just as tight as the belt is.
Okay, that's fine. Now you want this metal ring, you want this to be centered on the patient.
this one.
Okay.
There you go, perfect.
It's center now.
Okay. Next, what you want to do is you want to follow this strap here. Now, when the patient sits on it, it tends to get a lot of extra fabric underneath here. Okay. So grab here and pull away from the patient to pull all that slack out. Okay. And then you're going to go through this ring.
Got it.
And then back up and attach to the ring around the waist.
सर ऊपर वाले से ले
Okay. Next, what you want to do is to take your knee pillow. And always make sure that this is tight in here. So there's a handle right here. Make sure that that's nice and tight so that this isn't popping up. That should be secure in there.
Okay, that's okay.
Okay. So take your knee pillow and put it under the patient's knees.
Knee pillow.
There should also be a head pillow for under his head. Okay.
Yes.
Next, what we want to do is we want to do the thoracic harness. Okay. This one is going to come around and down to make an X. Now, what you're looking for is for the patients to come across the patient's lowest rib. That one needs to be pretty tight. Yeah, so you want the lowest rib to be right in the center of this, okay? So it kind of comes around that lowest rib to prevent the patient from sliding down.
See?
Maybe, yeah, down just a little bit, maybe.
Yes.
Yeah, that looks good. Now, come across and make an X to make sure you,
Yeah, it's making an X.
okay?
Yeah.
Now, the most common problem is that people don't get that on tight enough or on the right bony structure, and that the patient just kind of slides through it. Okay, so that's going to be the part you want to be the most careful with. Okay. Next, what we want to do is we want to choose our angle of pull. So now go ahead and go to the computer.
Yeah.
And then go to, you could choose, let's say we want to do L5S1. So go ahead and hit L5S1 and then begin targeting setup. Perfect. Now, once we've chosen our angle, now we want to pull everything nice and tight. Okay, so now we would come here, pull this nice and tight. Okay, so pull that towards the patient to get all the slack out.
Right.
And then go up to the top and pull this one nice and tight. Okay, so grab this, pull it tight, make sure all the slack is out.
Okay.
Okay. All right, any questions about this so far? All right, so next what we want to do is we want to choose our protocol. So now go into the screen, go back to our main menu.
Yes.
And then go to automatic decompression menu.
Okay.
And then select legacy number 1.
Okay.
And then hit, once it's done writing, you're going to hit confirm lumbar treatment.
Okay.
Now it may, if you in the upper left-hand corner, if it says press the patient's stop switch to finish setup, just go ahead and press that red button.
Okay.
On your cord here.
Yeah, that's there.
So you have patient safety switch.
Yeah.
Now on this patient safety switch, there's a little plastic clip here.
Yes.
With a magnet.
Yeah, that is there. Yeah.
Okay, there's a magnet in there. So whenever you're not using this, you can just put it on any metal portion of the table out of the way.
Any metal portion.
Yeah. Now,
Okay.
yeah, and then when you give it to the patient, you can use that little clip and just clip it right onto the harness. So
Yes.
if you give it to the patient, you can just take this clip. Just take this clip here and clip it onto the harness or clip it onto their shirt or wherever you want it. So that way they don't have to hold it the whole time. Otherwise, they might accidentally push it.
There's a patient.
Okay. Okay. So next, what you want to do is in the bottom right-hand corner, you see where it says treatment pounds?
Yeah, treatment kilograms.
Okay, yep, so go ahead and push that.
Okay.
Now, this is where you're going to put in 1/3 of the patient's body weight for lumbar. Okay, so how many kilograms does he weigh?
So we need to put
22.
Okay, so
He's
1/3 of his body weight is how many kilograms we're going to do.
22 kilograms.
Okay,
Yeah, so okay. I have put 22.
okay. So wait, so you're saying he weighs 90 kilograms?
He's weighing 66.
66?
So 1/3 is 22.
22.
Yeah.
Got it. Okay, so 22 kilograms is 1/3 of his body weight. And then in the upper left-hand corner, you see where it says treatment cycles?
Treatment cycle, upper.
Go ahead and press that.
Which one?
Upper side.
Treatment cycles लिखा हुआ है.
And then push 1 and then enter.
Actually, I'm not getting this treatment cycles. Where it is?
In the, you might have to press the patient stop switch. If it says press the patient stop switch to finish setup.
Yeah. Okay.
And then in the upper,
Now the treatment cycle is there.
yes, now in the upper left-hand corner, go ahead and press treatment cycles.
Okay, done.
And then put in 1 and then enter.
Wow.
Okay.
Now, what does your estimated cycle time say?
Estimated cycle time is 14 seconds.
14 minutes.
14 minutes. Okay.
Okay, so if we do 1 cycle on this protocol, that's going to be a 14-minute treatment. Okay,
Right.
go ahead and hit treatment cycles again. This time put in 2 cycles.
Yeah.
Now, what is your estimated cycle time?
I would say 16.6 minutes.
Okay, so now this would be a 16-minute treatment. Go ahead and put in 3 cycles.
And now it says 19 minutes.
Okay, so do you see how adding 1 cycle adds about 2 to 3 minutes per treatment?
Okay.
So I usually start everybody off on 1 cycle just to see how they do, and then go up 1 cycle per visit for the first 5 visits. So visit 1, 1 cycle, visit 2, 2 cycles, visit 3, 3 cycles, 4, 4 cycles, visit 5, 5 cycles. Okay?
Okay. For first 2 weeks.
Just for the first week.
First week.
For the first week.
Yeah.
Mr. Brian, day 1 will be 1 cycle.
Yes.
Correct.
Day 2 will be 2 cycles.
Correct.
Day 3, 3 cycles.
Correct.
Day 4, 4 cycles. Day 5, 5 cycles.
Yes. As long as you're not making them worse. Now, if the first visit, if they get really sore and they're in a little bit of pain, then you may not just do 1 cycle again, or maybe even less. So just as long as you're not making them sore or worse.
Okay.
Okay.
I mean, if a patient is complaining any kind of soreness or any kind of stiffness or pain, we should not increase the cycles.
Correct. And you may want to decrease the force at that point. So instead of, if he comes back tomorrow and he was really, really sore, then you may go back to like 15 kilograms instead of the 22.
Okay. So instead of 1/3, we should go to 1/4.
Yeah, you can do anywhere between 20% of the body weight up to 50% of the body weight as needed. For lumbar. Now, cervical is going to be only 10% of the body weight, but we'll do that one next time.
Sure.
Sure.
Okay. Okay. So now that he's ready, go ahead and so let's just do 1 cycle on him.
Okay, I'll go for one cycle.
Mm-hmm.
Right.
Now everything looks good, so go ahead and hit start lumbar treatment in the upper left-hand corner.
Okay. Done.
Okay. So now legacy number 1 is a very, very slow, very gentle treatment. Okay. It's the best treatment to do for the first 1 to 2 weeks.
Okay.
Okay. So on everybody, I would start with legacy number 1, just to make sure that you don't make them worse. Give them a very slow, very gentle treatment.
Okay.
Okay. Now, do you see on your computer where it says current force?
Different force.
Current force? What is your current
Sorry, current
force?
force. Yeah. Current force. It's 4, 5.
Okay. So it's going to go up about 4 kilograms per minute for the first 5 minutes. Okay.
Okay.
So this is a 5-minute warm up and then a 5-minute warm down. Okay. So it's going to be, again, it's going to be very slow, very gentle.
Okay. I mean, right now it's 4.
Okay. The second minute, it'll probably go up to about 8 or so.
Dr. White, it's already approximately 4 minutes.
It's a 5-minute warm
Now
up.
it's 8.
Yep.
Up
So
4
minute
minutes.
one is 4. Minute 2 is going to be about 8 or so. Minute 3 is going to be about 12 or 13. Minute 4 is going to be about 18. And then minute 5 is when we get up to our 22 kilograms that we put in.
Well, it was 16-minute session, 14-minute session, and right now we have got 3 minutes completed. I mean, 3rd
Correct.
minute is going on. And
Correct.
it's-
So it's just slowly going up each minute.
Okay.
Okay. Until it gets up to the 22 kilogram maximum that we put in.
Okay.
Okay. Okay, so sometimes patients, because this is very slow and very gentle, sometimes patients will say, I'm not feeling very much, and that's perfectly okay. You know, you want to reassure the patient that this is a very gentle, very subtle treatment,
Right.
and that's okay.
Yeah, Mr. Brian, it's 3 minutes completed. Now it's going to around 11, 12.
Correct. For the 3rd minute.
Yeah, for the 3rd minute now it's 12.
Correct.
And what about 4th minute?
Probably be around 18 or so. And then for the 5th minute is going to be when we get up to our 22 that we put in for the maximum force.
Did you see how gentle this treatment is? Patient is doing nothing.
Just consider one thing, that there are so many variables that makes it an art to learn. I mean, there are number of variables, just like many keys on a piano or keyboard. So you need to produce what kind of music you want to get to. So basically, I mean, there's lot many variables, and it needs your skills, your understanding, your basic knowledge, in-depth knowledge of the entire procedure. Age, body weight, height, disease. I mean, all these things we have to consider. So, I mean, it's just not that you take a patient, put him on the table, and just then. I mean, it's a very comprehensive, complete science and deep science. Yeah, it's now getting up to 16.
Yep. And it gets easier. You know, 1 to 2 months, you'll have all this down, no problem. It really, it's a lot at first, but once you get used to it, it's actually not that bad. And I have videos.
It would have been wonderful if you had been there in Pakistan.
Yeah, but I have videos that you can watch, and I have lists that that take you through step by step exactly what to do. So
Okay.
And then as it starts to pull more, you'll start to see the table separate a little bit more and more with each minute.
Treatment is for L5S1. So almost table distance has increased. This cushion is
moving.
So what's happening is his upper body is staying still, with the thoracic harness is holding his upper body still, and then all the force is going through the lumbar portion of the table. Okay, so it's going to hold for 60 seconds at its 22 kilograms, and then it's going to go into a relaxed phase of 11 kilograms for 30 seconds. And then it's going to pull at 22 kilograms for 60 seconds, and then it's going to relax at 11 kilograms for 30 seconds. Okay? That's kind of the gold standard for reducing a disc herniation or a bulging disc, is a 60-second hold with a 30-second relax at 50%.
almost 7 minutes gone, and now it's showing 21, 22.
Okay, yep, so now we're up to our maximum force. So now it's gonna stay at our maximum for 60 seconds, and then it's gonna relax for 30 seconds at half of that, so around 11 or so.
लेकिन ये 20-22 पे था, तब कम होकर 12 पे आ गया। वो 1 मिनट तक उसने होल्ड किया, फिर रिलैक्स शुरू कर दिया। अब रिलैक्स हाफ पे आ गया। अब ये वही बात है कि 30 सेकंड तक यहाँ रहेगा, then it will go back to 20. है कुछ इंटरेस्टिंग?
Mr. Patient, are you feeling anything?
Yeah.
Okay.
Mr. Patient.
It's pretty gentle. It's pretty subtle. So don't let patients dictate, that they should be feeling more, because really what you don't want is you don't want the muscles to guard or to go into spasm. You want the patient to be nice and relaxed. That's going to create the most amount of negative pressure inside the disc, which acts like a vacuum, and that wants to suck in the herniated or the bulging part. Okay, so you want the patient to be as relaxed as possible. You'll get more negative pressure generated inside the disc.
मुझे करवा देते खाली यार ये सही। मुझे जनक को लटा दिया। भाई कल आप यहाँ होंगे और जनक खड़ा हुआ होगा।
Okay, so did it go down to its 11?
Yeah.
Okay. All right, so now it's going to warm down over 5 minutes. So again, that first treatment is going to be very gentle, and we just don't want to make the patient worse, okay? So the first visit is just to kind of see how they do.
Yeah, Mr. Man.
Okay. All right, so let's go ahead and hit stop on the computer there.
Stop.
Yeah, now, it'll tell you on the computer screen, release the patient, then press to retract. So release the patient, meaning open up all the harnesses. Don't press that button yet. Open up all your harnesses first. Okay, now press that button on the computer to bring the table back together. Now, while it's coming back together, go ahead and slide the knee pillows out. And then go ahead and keep your knees up, Mr. Patient. Bring your knees up.
Your knees up.
Yep, there you go. And then just kind of rock your knees side to side, just really gentle. You just want to stretch the patient a little bit before they sit up. And then bring your knee up to your chest and stretch it. There you go, good. Okay, so I do this for about 1 to 2 minutes just to get everything moving again. Now go ahead and roll onto your side, all the way onto your side. There you go. Now use your top arm to push up off the table as you bring your knees forward. Okay. And then I usually have them sit there for just a minute, kind of let everything come back to normal, and then they can get off the table at that point. Okay, any questions about this?
Yes, what should be asked? I will be very detailed and understand it. I think as far as I'm listening, I am listening. I'm not a doctor. I'm not a doctor.